First, the pulpal and gingival walls are smoothed. Proximal line angles are placed, axial wall is planed, and the gingival bevel is placed. After smoothing the pulpal wall with the 42S off-angle chisel, we would drop down to the gingival wall to do the same, with very little effort because the walls are made quite smooth with the burr. The hand instruments preferred for most of the work are the 42 and 43S off-angle chisels. These should be used to smooth and sharpen the cavity, but are not efficient for cutting the bulk of the cavity. It would be too slow and tedious. So the 42S off-angle chisel is first used to smooth the pulpal wall. Only a few strokes are necessary with a sharp instrument. The buccoaxial and linguoaxial line angle is established with the 43S off-angle chisel as shown, because it is in the mesial box of the cavity. If it can be placed with a single or maybe few strokes of a sharp instrument, it adds to the crispness of the cavity, and of course it is much more efficient in time and effort. The 42S chisel would then be used on the distal box. The proximal walls and line angles are refined with the 43S off-angle chisel as shown. Since it is on the mesial aspect of the cavity, first on the lingual and then on the buccal, with only 2 or 3 strokes each. And the same for the axial wall, which is already smooth from the side of the burr, but we must remove the little gouge that we left with the first cut of the line angle. This shows again the corresponding off-angle chisel planes the axial wall. In this case, the 43S instrument with few strokes slides down the line angle, removing the little gouge originally placed as the line angle was established. Since the axial wall was left very smooth with a burr, only 5 or 6 strokes should make the line angles obtuse and smooth as well as the wall. This brings us to the last step of instrumenting the cavity. This shows graphically the placement of the gingival bevel using the number 233 marginal trimmer, which has been altered to be a long beveled instrument. Very little amount of gingival wall needs to be beveled, but we do like for it to be smooth and even. The number 232 marginal trimmer would be used on the distal margin. As you see, the gingival wall on this diagram showing the bevels placed are equally satisfactory in the way the gold will approach the root surface. And it is obvious how much less tooth structure must be removed in the small bevel. And this is sometimes difficult tooth structure to remove. So we make it easy by using the small amount of bevel, but very smooth and even. This shows the amount of angle needed on the blade of the marginal trimmer. The more blunt bevel does not create a desired plane on the margin, so it must be sharpened to a sharper angle, or use the number 232 and 233 marginal trimmer with a tucker mark on it, which is already altered. You might notice on this drawing that the bevel is minimal, with the burr leaning the slightest amount, and because of this, the beveled incline includes perhaps 2/3 of the wall. The angle of the bevel is not always the same, depending on the incline of the cusp that is being beveled. When we ask what is the ideal amount of occlusal bevel, these diagrams clearly indicate that it varies. Tooth lettered A with the sharp cusp inclines would need no bevel in that the cusp cavity angle is already obtuse, and the enamel rods are on such a plane that they are not likely to break down. If you observe the same tooth lettered B, you can see that if the bevel were placed, it would blend into the cusp incline, and of course we would not be even able to see where the cavity begins or ends. The tooth lettered C shows a rather flat occlusal, so the cusp cavity angle is more acute, and unsupported rods could break down, so we need more bevel on this margin. And as you see on tooth letter D, it will not destroy definition of the outline. The same principle applies to different areas of the same preparation. There is not necessarily the same amount of bevel over the entire cavity. Generally speaking, the more flat the occlusal plane on any area of the cavity, the more bevel is needed on that cavity.